Good morning, one and all. I am Dr. Karthika, Assistant Professor of Microbiology Department from the SFR College. In this video, we are going to see about the pox virus. So, throughout this video, we can able to see the introduction about the pox virus and the cause and the pathogenicities, then symptoms and then treatment and the preventions. So, coming to the introduction, the pox viruses are the family of large complex DNA virus belonging to the family Poxviridae. This pox virus refers to the family of large complex virus characterized by the treff of bricks or oval shapes and double-stranded DNA genome. They are known for their causing various pox diseases in humans and animals, including the eradicated smallpox. The family Poxviridae includes several subgroups, some of which infect the humans. So, this is the diagram of the pox virus. This belongs to the genome of double-stranded DNA and the size is among 200 to 400 nanometer. It is a brick-shaped or oval type of virus. Envelope has a complex outer envelope with a simple lipid bilayer, and the replication mode is unusual of DNA virus, which replicates in the cytoplasm since it carries its own transcription enzymes. Coming to the classification, it belongs to the family Poxviridae and also it consists of subfamilies like Chorodopoxvirus and Entomopoxviridae. So, among the pox viruses, the important human type of pox virus is the variolovirus, which is responsible for the cause of smallpox. It consists an envelope, core envelope and the linear envelope and the outer layer which has the surface of the tubules, which is helpful for the attachment of the host. This is the oval type of smallpox viruses. The main cause it is caused by the variolovirus, which is the family, it is a member of the orthopoxvirus genus Poxviridae. And the transmission, it is transmitted through the respiratory droplets since when it faces to the face-to-face contact and the direct contact with the skin lesions or the scalpels, and fomitus, which is transmitted to the contaminated clothing and bedding. In the incubation period, it incubates among around 10 to 14 days. Coming to the symptoms, it causes two type of phases, that is prodromal phase and the eruptive phases. In prodromal phases, it is extend up to 2 to 4 days. In these phases, the patients will have high fever, that is 39 to 40 degrees Celsius, and severe headache, fatigue, vomiting, and sometimes delirium happen. And in these cases, rashes were not visible. In the operative phases, that is after 5th day, rashes starts in the orophaxy phases and the extremities, and lesions evolves synchronously. The lesions will be the macules, papules, vesicles, pustules and the scalps. Coming to the treatment, there is no specific treatment in the early days, and supportive therapy is the isolation of patients, hydration, nutrition, fever controls and management of the secondary bacterial infections. In modern options, it can be eradicated by the technovirimat and the codiformin and the bridicomicin. That is, technovirimat is ST246, which is an FDA approval antiviral for smallpox. It can prevent the viral spread within the body. Cidofir and the bridicomicin, it is an experimental antiviral which is active against the orthopoxviruses. Prevention, the vaccination with the vaccinia virus, that is a live attenuated virus, which is highly effective, provide a long-lasting immunity. WHO mass vaccination campaigns eradicate smallpox in 1980. Today, vaccination is reserved for the laboratory workers handling orthopox virus or during the outbreak of related virus, that is the smallpox virus. Coming to the vaccinia virus, which is used in the eradication of the smallpox vaccine. This is the diagrammatic representation of vaccinia virus. It belongs to the orthopox genus of family Poxviridae, not a natural human pathogen, but it is used in the laboratory adapted virus closely related to the cowpox and the variola. It is best known for the live attenuated vaccine used in the smallpox eradication. It occasionally causes complication after some vaccinations. So symptoms after the vaccination, sometimes it may be common reactions will appear after the vaccination, that is the redness, swelling and soreness in the vaccination site. Some complications, rare but important, are accidental auto-inoculation, generalized vaccinia and the post-vaccination encephalitis. So accidental auto-inoculations, it is spread by the vaccinia to the eyes or other skin areas. Generalized vaccinia, rashes with multiple vesicles on the bodies, and post-vaccinal encephalitis, rare but serious central nervous system complications. Coming to the treatment, most mild cases resolves without the treatment. Supportive care is must. Wound care, hydration and fever control. Severe complication will lead to the vaccinia immunoglobulin, that is antibody therapy of serious vaccine reactions, and cidofovir and the bricinifordir antiviral that may be helpful in the severe progressive vaccinia. Tecnovirimat is also used, it's active against the vaccinia, used in the emergency period only. Prevention and control. So vaccinia virus vaccination, that is the live attenuated vaccine which is eradicated the smallpox in 1980. It is also used as a routine vaccination which also stopped in the worldwide after the eradication, but it still be used for the laboratory workers handling the pox virus, then military personnel in certain countries, at risk groups during the monkeypox or the bioterrorism threats. Thank you for watching.